Hello, everyone, and welcome to the Global Infertility Fertility Support Summit. I am Dr. Amy Barron. I am absolutely thrilled to invite you here as the host and as the moderator of this session. As you all probably know, today is May 7th. In the US, Mother's Day is just around the corner. You're likely getting targeted with Mother's Day ads and gifts ideas, and you're probably starting to think about what you're going to be doing to celebrate the mother in your life. I also learned that today, again, May 7th, is Bereaved Mother's Day for everyone out there who has lost a baby via miscarriage, stillbirth, infant, child, or adult. So these are complicated, mixed emotions that we're all carrying with us right at this moment. And I think that the feeling of the twist of the knife and the pang of the hurt that's associated with these days represents so many complex feelings. It's a reminder of what you or someone you love is longing for, but may never have. It's a reminder that everyone in the world may be dealing with something, may be struggling with something that you may know nothing about. And so therefore, it is no coincidence that we chose specifically to hold our fertility summit today. Our audience today consists of community leaders, rabbis, organizational representatives, and also it consists of individuals who are wading through their own fertility experience, hoping for a miracle. You out there, you might be waiting for your first appointment at the fertility clinic, or maybe you just started your first round of IVF. Maybe you're recovering from a surgery that you needed before you could even start to even begin treatment. You might be feeling crushed under the weight of the financial responsibilities or guilt around a diagnosis. You could be suffering with secondary infertility and wondering how to set boundaries with all the people talking to you about giving your kid a sibling. Or maybe you are a friend or a family member of someone who's going through this and you want to know more about what the experience is like. Ultimately, what matters most is not who you are or what the specific story is. What matters is feeling supported, validated, and loved. And what also matters is that you need the tools to get through this. So today, we are bringing you the voices of 2 MDs, 3 PhDs, 3 mental health professionals, 3 rabbis, 1 yoetzet, 3 CEOs, 3 executive directors, and 1 person who knows everything there is to know about surrogacy. These are some of the most prominent voices in the Jewish fertility community. And I'd like to begin by thanking them for taking the time to be here for all of you today. The existence alone of what they have built and represent is a statement of just how far we have come as a community in terms of how we deal with fertility challenges. During our time today, we are going to validate, educate, and create a framework for making true systemic change within ourselves, our friends, our families, and our communities. And we remind you to be conscious of that throughout this event. And as you're thinking about all different kinds of questions and responses that you are going to put into the chat, and we'll get to that in a second, we want to remind you to please be inclusive, because no matter what you are going through, no matter what is going on, we believe that there is no room for theological, geographical, gender-related, or any differentiation when it comes to these issues. All human beings have the potential to struggle with fertility challenges, regardless of what they look like, where they live, or what they believe in. This summit is for everyone. So for the first session of our program, we're speaking to you, the individual experience. We're going to talk about what it's like when you realize that your family building expectations aren't being matched, and what it's like to start at a clinic and accept your situation and navigate them. That's our first panel. Our second panel will take us into the treatments, the spiritual crises that some face, and the common struggles that some have with intimacy and the likelihood that their partners are not on the same page emotionally, financial difficulties, and the choices to use third-party reproduction. And then finally, we'll close with how to just make it all a little bit easier through boundary setting, self-care, and learning to advocate for yourself. Lastly, just before we start, a couple of reminders. So we chose this webinar format specifically so that you could have your screens off and your name hidden. However, we want to make sure that you want to be that way. And if you do, you must rename yourself if you want to be seen that way, because your participation here is 100% anonymous. So if you want to post at all into the chat, please make sure you rename yourself. And feel comfortable knowing that your identity remains anonymous and that your shared experiences, whatever you choose to put into the chat, will likely be helpful for others to hear. We hope that this helps you feel comfortable participating in the chat. And when we ask the more sensitive prompts, please have that knowledge in mind. Lastly, one more housekeeping point, and then I promise we're starting. All of you will be getting a detailed resource packet tomorrow evening, along with both of the recordings of the 12 p.m. program right now and the 8 p.m. program, which include the names and the contact information of all our sponsors, all our speakers, and all the participating organizations. So if you need to step away at any point today, have no fear. You are not going to miss anything. And lastly, before we bring you these conversations, we just need to thank our incredible sponsors, and we're going to be doing that over the course of this program. So first, I'd like to thank our platinum sponsor, Maze Laboratories, and here is a video from them.
I am Michael A. Werner, MD. I'm a urologist specializing in male infertility and male and female sexual dysfunction. I'm also the medical director of Maze Laboratories. One of the things I'm proudest of is that in the last 3 years, we brought a new technology from Israel. It is called ESSM, and what it does is looks for sperm in men who have no sperm in the ejaculate on a regular semen analysis, or finds sperm in men who have very low levels. And we have found that in men with no sperm, 50% of the time we can find sperm. And in men who have low levels of sperm, we can find sperm almost 100% of the time. But not only do we find the sperm, but we're able to take them, put them into little wells, and freeze them in a way that, one, allows them to be found quite easily by the embryologists during an IVF cycle, and two, allows them to survive the freeze and thaw process with a very high success rate. In fact, we have one patient who underwent 2 open biopsies and no sperm were found, and then we found sperm in the ejaculate. Thank you for your time, and if you would like more information, please come to our website at mazelabs.com. I'm unbelievably excited about the fact that we have introduced ESSM to this country, and I do think it's going to be the gold standard of care for men with no sperm in the ejaculate or very low numbers.
Okay, perfect. Maze Laboratories, they're an amazing resource, and we're so thrilled to have them as our platinum sponsor. So let's get started. I am thrilled to introduce to you our first 3 panelists, Chani Levertov, the founder and director of Fruitful, Michal Rones, who's the coordinator of the Yoetzet Halacha Fertility Counselor Project and Nishmat Habayit Research Institute, and Suzanne Sackstein, the founder and director of the Malka Ella Fertility Friend. And in this session, we're going to be talking about all of the things that people think about right in the beginning as they're starting their fertility journey. This session is called So You're Not Getting Pregnant, Accepting Your Diagnosis, Navigating Jewish Law and Fertility Treatments, and Relationship Challenges. So let's get started just right at the beginning. Chani, Suzanne, Michal, thank you so much for being with us. Trying to get pregnant is really hard for some people. I mean, for others, it's just, they seem to just drink water and everyone says, that thing, just drink the water and I get pregnant, or I just look at my husband and I get pregnant. But for other people, it's not that easy. Month after month, they're disappointed. Month after month, they feel their hopes crushed. So can you tell us a little bit more about what it's like for a couple? How does it affect them? And when should they start to consider treatment? Suzanne, I'm going to come to you first.
Okay. Thank you very much. I think it's extremely difficult because, everyone begins their married life with this hope that they're going to be able to build a family. Well, I would say really most people. And so when it happens that either, very early on or later on in their marriage that they can't, it's almost like this hope of having this ideal place in their life is totally shattered. And I think it's very, very difficult for couples. And it does also depend. Often the one partner in the couple takes enormous amount of blame. It depends on where the fertility issue generally lies. But I think that it's very hard because they think the answer to having, a perfect marriage and everything, because they look around them, is to have a family and to have a child. So, I really think it depends on someone's age and if there are pre-diagnosed issues that people would have dealt with previously. But I would not, the guidelines that we work to in South Africa is that anyone over the age about 30 after 6 months should really consult with some type of gynecologist or fertility doctor. And someone under the age of about 25, hopefully before they definitely, they should be, if they haven't fallen pregnant. So often it's really not a big issue and it can be dealt with, but it takes enormous amount of strain on the couple, blaming, shaming. It can be really, really difficult. So I think is that they also seek out emotional support as well. I don't know if that answers your question.
Absolutely. Chani, can you tell us a little bit more about, you deal with couples all the time. All of you do. And I know that some of these people come to you in these, in these moments of like, what do I do? And how am I possibly going to get through this? What do you say to them? How do you answer these same questions of, how does it affect them? What emotional state are they in when they're coming to you?
So first of all, I agree with everything that Suzanne just mentioned. As well, can you all hear me? Okay. I agree with things that she brought up, that it's very, people are concerned and anxious if they're not getting pregnant, even after 3 months or 4 months, because every month is an eternity for a couple who is just waiting or is just going into, starting their marriage or whenever they decide to have children. Just even waiting 1, 2, 3, 4 months just feels like an eternity. So when they do come to me, validating their emotions and their feelings is really extremely important, so that they can feel comforted and know that they're not alone in their feelings. Because, speaking from experience and personally, as well as dealing with many couples and individuals who are trying to conceive, what's most comforting is knowing that and validating their emotions and their feelings, that they are not alone in how they're feeling and their anxiety about it. And then just really holding space for them and being there for them, and trying to reassure them, not in a way of telling them it's definitely going to happen and but just handing them tools and helping them navigate the journey, which can be extremely overwhelming and scary when you're starting off. And I agree again with, under the age of 35, it's recommended to wait up to a year to see a specialist. And then if you're over 35, it's recommended to see somebody after 6 months of trying. That's the official time that they recommend.
Right. And I'll even add, as a medical physician, though pediatrics is my specialty, the recommendations are even further. Over the age of 40, they say that you should really only wait a couple of months. If you're not getting pregnant within a couple of months, you definitely should seek out treatment. Okay, Michal, I want to come and turn to you, and we're going to ask some of the others to participate in this question also, but the piece that really stymies of so many people from seeking out treatment, especially in the religious Jewish community, are these questions about halacha, these questions about Jewish law, and what does Jewish law allow? What does Jewish law not allow? Like, are fertility treatments allowed at all? I mean, some people have this notion, and I actually just got this question yesterday on one of our posts on Instagram. People said, does the Orthodox community allow IVF? Which I thought was such a wild question, because and then now I'm really going to turn it over to you, but I'm not going to give it away because, that's not my job here. But I really wanted to hear from you. What are the most common questions that people ask? What kind of advice do you find yourself giving at most commonly during people at this stage? When does there need to be a rabbi or a clergy involved in this process, if that's part of the language and that's part of your way of life? And I want to preface this by saying that not everyone in the Jewish community chooses to seek out a rabbi or a halachic, a figure that deals in Jewish law when they're considering fertility treatments, but some do. And so what do we say to all of them? What do you say to all of them as someone who sits directly in this space?
Okay, so thanks, Amy. I think that we're often a couple starts asking the question of what's wrong with me or what's wrong with us. And although on the medical side, we know that if they go to a doctor too quickly, then the doctor may say to them, just wait. But on the other hand, on a social level and often in the community, when you see everyone around you getting pregnant very quickly and you're waiting month after month, that waiting makes you feel so helpless. And then as far as if you're in the religious community, and so a lot of babies are around, everything is family oriented. So then that even raises even more the level of impatience, anxiety, and difficulty on a day-to-day basis. So firstly, for women who are also observant of the halacha, of the Jewish law, sometimes they have the extra fear that possibly things that I'm doing because of Jewish law could be affecting my opportunity to be able to get pregnant, which just to say in one sentence, maybe they're not being able to be together with their husbands at the time that will enable at the time of ovulation, which will enable them to get pregnant. So what we find that we're doing when we're sitting with a couple is as well as like what Chani was talking about validating about the way they feel and understanding the challenges they're facing, also to provide information that they can really use, like some basic questions. Do they know when they're ovulating? And are they able to be together with their husband when they're ovulating? Often there's a lot of anxiety that maybe because I'm observing the Jewish law, I may never get pregnant. And so one of the first things that we will say when we're sitting with a couple is that is not something you have to worry about. It's something we have to deal with. And there may be things that are causing added difficulty, but we can deal with that. Jewish law deals with that. And so in answer to your question of does Jewish law allow IVF? So in Israel is one of one of the top places of the most highly the high amount of IVF rounds done per person, and is highly also provided economically with economic assistance. And that's for many couples who are observing Jewish law. So I'll just say in one sentence, not only is IVF allowed, but so is surrogacy, so is donor sperm, so is donor eggs. I'm not saying that it's an easy thing in any situation, but there's always an answer for something. And so one of the next sentences that I will tell a woman and a couple is, do not worry, we are here for you, and we're going to work together and be here with you on your journey to get to where you want to get to.
I love that. I love that. Chani, any other thoughts in regard to that? I know you deal with all kinds of couples, and you specifically as you're also a supervisor, you help supervise some of the treatments in some of the clinics. What advice do you give when people are wondering how are they navigating these pieces?
So it's very similar to Michal, that, you know, it's just about walking them through the process and just really reassuring them that, you know, personally, that I'm here for them. Any questions that might come up. Again, it can be so overwhelming, just everything from the beginning until you're actually experiencing the treatment. And, you know, for me personally, I always like to know, to the extent that I can, what is going to happen, you know, what the IVF process looks like, what the, you know, you mentioned I'm an observer in the lab, what that might look like, you know, for the patient, which they, you know, I just like to give them as much information as I can and reassure them and just comfort them, because I know what it feels like. And I can only imagine, you know, all the anxiety that it comes with. So.
Absolutely. And Suzanne, talk to us a little bit about, you know, when someone is trying to choose a clinic, if they've gotten their diagnosis, they know that there's a problem, and now they know they need to, you know, take the next step. They need to choose a doctor, they need to choose a clinic. Like, what can people expect emotionally from this process? We're not, you know, we're not here to talk about the medical aspects of, okay, you're going to get here, you're going to see this doctor, you're going to see that doctor, you're going to get this blood test. That we leave to the medical professionals. Here, and I was supposed to have a baby in this summit, we're talking about the emotional pieces. What can people expect their feelings to be during their first appointments? And why do people always talk about the waiting? Why is the waiting so hard? I think Suzanne dropped off, did she not? I think she's been having trouble with her internet. So Michal, I'm going to come back to you while we're waiting for her to join. Why do people talk so much about the waiting? Why is the waiting so hard for people?
So I think that it's connected to that we live in a way of life now that we try and have control over everything that we're doing. And we're lucky because there are many things that we can control. But when it comes to this, suddenly people feel helpless, they feel disempowered, they feel that they have to turn to doctors, and they don't, as you were saying, they don't necessarily understand what to expect. And it's also within their relationships. So when you're also starting to think, why is this happening to us? And is there something wrong with me or with my husband? And that also starts to put pressure on the relationship as well. So all these things together, as well as if they've started the process of doing diagnosis or even fertility treatment, then they start having hormones and medical challenges, which just increases the waiting time to be even more stressful.
Definitely. Okay, Suzanne, I see.
Sorry, Amy, I lost internet connection. Yes, you asked me a question.
Okay. It's okay. We're glad you're back. I wanted to hear from you
we've got a storm here we've got a storm going on here, like a nice electric storm going on. So I think that the internet is up and down. Anyway, I've tried to join on a different connection now. So I'm sorry, I didn't hear the end of your question.
No. Welcome to real life, everyone. We are thrilled. This is a live summit, and we are so lucky to be able to have people from around the world. And we obviously are not controlling the weather. So Suzanne, while we have you, the question was, you know, okay, people, so now they have their diagnosis and they know they need to seek out some sort of fertility treatment. What advice would you give to someone on their, embarking upon this, the emotional space that they're in, how they need to reach out. They don't know who to reach, who's the best doctor, who are the doctors. And then once they're in the process, tell us a little bit also about the waiting, because the waiting is so hard for people.
Mm-hmm.
It's almost as if, like, I hear a lot this notion of the hurry up and wait. And in fertility, we all know.
I think
yeah, go ahead.
I think what's very challenging is that, and I said when I spoke in the beginning, is that often it's something really small and we can work out, and it can be that they're ovulating maybe before they go to the mikveh, if they do go to the mikveh, or there might be, that they're not ovulating correctly and we can give them medication. So often it's like that, but many times a couple's faced with a diagnosis that just blows them out of the water. They had no idea. And they are just, it's like it almost shatters their world. So, a young couple who all of a sudden have, they have gone through, she's 22 years old and she has gone through menopause, and she had no idea that this was ever going to be. And she now has to face the diagnosis of, if she ever wants to have children, having donor eggs or multiple miscarriages. And so I think, and what everyone said, Michal and Chani, and I'm sure that your other panelists will say, that it's a really multi-pronged approach. So it's not just about, one can never just deal with the medical side, or one can never just deal with the spiritual side or the economic side, because that in itself can be an enormous strain on a couple when you're looking for, and I mean, I know it sounds a little bit enraged, but I'm saying you're looking for all of these things come into play. And so, and there's the emotional support. So I think that we need to really get a very clear sense of how we can holistically support the couple. So, and hold them and say, we are here, we are able to get you through however that is. And sometimes, they have to face their worst fear, which is, I need to have a surrogate, and this was never where I was going to go. And so, I mean, I think it's important, as Chani said, that they know where they're headed. However, sometimes, too much information for couples that are just starting their journey becomes very overwhelming. So I think as people that work in the field of infertility, if we can just almost make, guide them, and make it feel, as you said, as you started, a safe place, something, there are a lot more people that have children than people that don't have children, even though there are many people that struggle and their journeys are not easy. But, we can guide them in this positive and trying to keep positive and, okay, so this time it didn't work, but, we've got plan B, we've got plan C, D, E, F, and it depends on how much the couple are willing to do. But I think that it's got to be this holistic approach, because if not, I think that the couple really, and the very important thing, which I've seen in my experience, is that you have to hold the couple, their relationship, because there's no benefit for someone having a baby and then getting divorced directly afterwards, because all they thought was that this was going to answer every dream that they ever had, and they have this baby and they forgot about their relationship for the last 6 years. So I think that we need to do it all, and it's got to be done in parallel, calling in different kinds of professionals from all different areas. So yeah, I don't know if that answers the question.
Absolutely. And you're bringing me to really my last question here. And Michal, I'm going to come to you again, just picking up exactly on what Suzanne said. The goal for all of this holding, the goal for all of this, comfort and support, and the goal for these couples, these individuals who are embarking on this journey and trying to build their family, the goal is for not for them to fall apart. The goal is for their relationship to remain solid as they're traversing through all of this pain and this entire journey. And so we know that receiving a diagnosis is an incredibly challenging experience, as Suzanne just mentioned, guilt and blame and all of these pieces. What do you say? Suzanne just gave us her thoughts. What do you say to these couples who are just, you can see how distraught they are, and you can see sometimes that they're really not connecting. How do you get them into a better space to be able to embark upon what you know is going to be even more difficult?
Okay, so first of all, I think that it's very normal, the stresses and the difficulties, and for that to put a strain on a couple to recognize this is normal, and it's even to be expected because of everything that's going on. And then to look at what can we do to make this this process less suffering, more empowering, and feeling as if growing together on this path. And that's why what's so amazing about this summit, because you get the feeling of there are so many organizations there that a couple should feel, or that they have who to turn to and where to get the support, depending on where they're finding the biggest struggle. And so, like, we will definitely, when we're meeting with a couple and we feel that the suffering is starting to weigh down on their relationship, then seek out help. And often this is something they can't discuss with anyone. So many people tell us that their family doesn't even know what they're dealing with. Everything on the outside, it looks as if they're completely functioning, everything is fine, and inside their world is falling apart. So to not go on this journey alone, because there are so many people who can help you in a discreet way and still feel as if you're not alone. Even if you feel as if you want to keep your privacy, not share it with the community, or possibly with people in your family, but that doesn't mean you need to go on it alone. That's what I would.
Beautiful, beautiful. And last quick question for all of you as we close out this panel. What would you like to tell the people who are listening today? What do you want them to know? I mean, I know that you've shared so much already, but if there's one small, tiny nugget, just a few seconds, what would you like to share with them today? Chani, I'm going to come to you first.
Okay. Oh, so much. But just, we are truly here for you. I think I speak for everybody in this greater summit and both parts of the summit. Really, really, you do not have to do this alone. We are all, that is why we're doing what we're doing. And we are here to hold you, to walk you through anything we possibly can, to answer your questions, to just listen while you cry, or, talk about anything you need to talk about. And just sending you a big hug.
Thank you. Thank you. Suzanne.
I mean, absolutely what Chani's saying. And I mean, I don't know the other people in other organizations, but many people are involved in this field because they themselves have had some type of personal engagement with fertility, either themselves or their family. And to really say, there is hope out there, and there's medical interventions all the time, and things that we never thought were possible 10 years ago are. And and we are here, and not only are we here, the professionals are here, and there are many, many amazing things that you can actually do and today, and to keep an open mind, because in our experience, literally in Multi-Faceted in South Africa, and it is a smaller community, but people are prepared to do what it takes. They may not have the child that they want, they may not have it in the way that they want, but their journey ends in some way or other. And I really just feel like if you can keep hope with positive people around you, I think that could be something that would be very helpful.
Beautiful, beautiful. And Michal, please close us out for this session.
So I feel as if I connect to both Chani and Suzanne, what they said, that not to be alone, because we're here to give you support, and to keep that hope. Because at this moment, maybe you feel like your world is crashing and you don't know where the light is going to come. Take a deep breath, and together, Bezrat Hashem, please God, we'll get to the place where we want to get to. And that we'll be blessed with feeling that beauty that we're waiting for.
Amen. Amen, all of you. Thank you all. Chani Levertov from Fruitful, Michal Rones from Nishmat, and Suzanne Sackstein from Multi-Faceted in South Africa. Thank you all for being here. Thank you. That was an incredible, enlightening conversation. We are now going to move to part 2 You're welcome. You're welcome. We are now going to move to part 2 of our summit. But before we get to that, I just must thank our gold sponsors. Our gold sponsors are CCRM Fertility, the Eden Center, the Eden Center, Merkaz Eden in Israel, Hadassah, Jewish Fertility Foundation, JOMA, Jewish Orthodox Women's Medical Association, Mayim Hayim, OHEL, Stardust Jewish Fertility Foundation, and Taharenu. All of their information will be coming to you in the resource packet right after this summit tomorrow evening. Okay, so now I'd like to welcome our second part. Now, this second part, our second panel today is called The Waiting Game: Financial Struggles, Spiritual Crises, and Third-Party Reproduction. I'd like to invite Rachi Hain, BSW, the founder of Merkaz Panim, and Rabbi Idit Soloman, the founder and CEO of Hasidah. I just want to make sure everybody is here. Okay, perfect. I'm so thrilled to see all of you. So let's get right into it. It's around this time in the fertility process. We're in the middle of it. We're in this waiting game. We talked about the waiting game in the beginning. Around when people are like knee deep in research, learning about this entirely new world of fertility treatments. We know how hard it is. Many of us know how hard it is personally. So let's get into the thick of it with 3 specific areas. Let's deal with the financial planning first. Rabbi Soloman, I just want to make sure that you're here. Okay, I think she's just getting herself settled. Perfect. Here's our question. The financial planning. The financial burden of fertility treatments is significant, especially in the United States, but definitely around the world. Rachi Hain, we're going to come to you in a second because we know that the financial piece in Israel is different, but I want you to respond to this too, but I first want to come to Rabbi Idit Soloman. So the question I have is, how does one set the financial boundaries? What are the resources available to people who are looking for financial support? And how can we be more sensitive to people who are dealing with financial stressors? Look, I mean, let's call it what it is. We live in the United States. I live in the United States. Rabbi Soloman is also in the United States. And fertility treatments, depending on where you are, can cost upwards of $20,000. And that's one cycle. That doesn't take into account different, what if that fails? What if you need to do a frozen transfer? What if there are 1,000 different things and pieces that go along and go into this? That's one cycle. So can you give us a little bit of color? You as the CEO and founder of Hasidah, you deal with these issues all day long. Give us a little bit of color into some of the financial stressors that people are dealing with.
First, just thank you for being here. I apologize. My camera went wonky in the last minute, but I am very grateful to be here. And the one thing to know is that research has actually shown that one of the number 1 limiting factors for fertility, whether or not you're experiencing infertility or not, is actually finances. In the United States, finances are the major concern people have for having a family. Now, on one hand, that shows great progress in humanity, that we are so comfortable and we have so many things that, we want to have a good life. But on the other hand, it also is showing the reality of kind of a broken healthcare system, of younger people then who are delaying having children a lot more because they want to be financially stable. So the costs of fertility treatments are, in many cases, second, because people are often concerned about how to navigate the cost of being Jewish, the cost of owning a home, and all these different things. And then when you're facing infertility and the reality that you may have to actually pay out of pocket before you get a chance to do something is, that's just mind-bogglingly scary. And the costs may start in the thousands. And the reality is, yes, thousands is a lot of money, but if you're going to be a parent, then you're going to have to recognize those costs may come up. But we're talking about tens of thousands, and it can go to 50,000, it can go to 100,000. So one of the things about recognizing how to deal with financial boundaries is first recognizing you have to have them. We may have thought about what our boundary is to buy a house. We might have thought like what our expenses or to get by or whatever, but no one's really thought about how much I would spend on treatment if that's the case, or adoption. So it becomes really paralyzing when someone says, because this is the questions that go through people's mind, is how much is it worth to me to have a baby? Which is an unanswerable question. You can't say, well, okay, I'll spend $25,000, because what if treatment is $30,000? It feels like a failure to say, oh, well, I didn't have $5,000, so I guess I don't care enough. And that's not really the decision we're making. So understanding what our priorities are and having a healthy relationship to how finances factor in to having a family, that's really the questions we need to ask. And we're not prepared to ask those in terms of having a baby. And it's also can feel very sterile. Like, how do I set a boundary on what I'm willing to spend here when it's like, it should be priceless. I should be willing to spend anything. How do we reconcile that? How do we come to a healthy relationship, healthy being used very generously, to making these determinations about what is the right amount for you in order to do that? And then add on, how do you come up with that? And I'll stop there for a second, because how to come up with it is also another question, but I want to pause.
And speaking of how to come up with that, Rachi, I want to come to you, because in Israel, the financial structure in terms of getting fertility treatments are different, but there are other concerns that come up as people are dealing with fertility challenges, specifically related to finances. Can you tell us a little bit about that?
Yeah, correct. So one of the things that I wanted to address as far as the financial stresses is the relationship we have with the people that are helping us financially. In many cases, our parents, and just the borders between how much information I need to share with them, how much information they demand from me. I would say one of the things that's very, very important with parent-child communication, I'm talking about parents who have children who are going through fertility treatments, is to be able to say, we are your parents, we are helping you financially, we trust you, we believe that you know what you're doing, and you don't have to give us then a report of exactly what's going on and when it's going on. It's not easy for parents to do because we care and we want to make sure that our child is getting the best care, but our child is no longer a child, they're an adult that's facing a fertility process. And we really want to try to empower the couple to be able to get through it and to be able to be adults that are getting through it and facing the challenge. And sometimes that means saying, I'm giving you the financial support, and then I'm sort of taking a step back and you let me know what information you want to give me and when, but I'm not making I'm not holding the purse strings and saying, if I'm giving you support, you then have to report back to me and tell me what you're doing and what you're using the money for and what you're going through. And even just to be able to ask parents to give financial support, it's often a matter of saying, we need some help financially. We'd rather not get into the details of what it's for, and to be able to respect that because the couple needs their space there.
Absolutely. I love that you brought up that point, because it's such a crucial piece, especially for places where fertility treatment is not free. You're often dependent on others in your life to be able to help finance that, and that interplay with and that struggle, that tension of, how much do you share? How much do you not share? How much do the people need to feel like they've, gotten their investments worth, and getting the information? It's very, it can be very difficult. But Rabbi Soloman, Idit, I want to come back to you. And you said, the one thing that you left off of your last response was the what can you do about it. So can you give us a little bit in the what can you do for people who are struggling financially, who are not sure whether they're going to be able to have a child and they need the money to do so? Give us some options. I know Hasidah specifically gives grants for people, but can you just give us, a minute on the broad array of options? And there are many, but there are not enough. I'm just going to say that and put that out there, but can you give us a window into what that looks like?
Sure. And then I can also put an attachment, if I'm able to do it in the chat, with some options. The major thing is that people haven't planned for this, most people. Now, I need to be realistic, and that's to say, in the LGBTQ community, the idea of, for example, third-party reproduction is a given, and the fact that there's going to be some amount of money involved is known. So for a heterosexual couple, the idea that money in the first place is going to come into this is new. So it's often seen discreetly, like, I need money for fertility. And one of the things that's really helpful is to imagine, actually, you just need money and you need cash. And I'm speaking very practically here because I think that's most helpful. And that's part of it, recognizing there's an emotional aspect of this, and there just has to be a nuts and bolts. You need money. Sometimes one of the things that I learn in speaking to people is, for example, you actually may qualify for a small business loan, which means you're freeing up money from something else. And that's one of the helpful things, is to recognize access to cash and money is really the goal. It's not necessarily access to funding for fertility. You have to look at your whole financial picture. And interest-free loans are great. It is hard to have to pay it back, for example, if it doesn't work, but at least if you're paying it back, you have a lump sum of money, maybe, and you have more opportunities. I don't recommend necessarily any of the things, and again, I'll try and put the list in the chat, but there really are options like, and I did what we once got an interest-free credit card loan, and we put one of our treatments on a credit card because we knew it was right for us, because we knew we could pay it off in 2 years. That was also a way to get a free loan. Sometimes it's also speaking to the clinic and just asking. Many people are just afraid to ask. There also the grants. I mean, there's a caveat. Hasidah does offer grants. It's kind of like it's honestly, it's a bit of a unicorn of the amount of people who are going through this, and the amount of people who know money, need money. It's a small amount. And I've spoken to the many wonderful other people who are in this field. We all wish we had a lot more money and could give out a lot more. But there are also discounts on medications. Some of the medications cost $3,000 out of the gate. So in that regard, $500 doesn't seem like a lot, except for if you put away that, like, it's $500. That could be a car payment. That could be, all these different things. So discounts on medications, also learning to ask insurance, even if you know they're to decline them. Insurance is changing. And the more we ask, the more we're showing that there is a need and a desire for this. So that's a start of a different way. Part of it's just thinking about it differently. And the reality is, you got to be kind of scrappy and recognize if it's $100 here and $300 there, that does add up, even though it feels like a lot of work for a little bit. And you also have to decide how much you're willing to do for finding these financial resources. Like, some people are like, fine, I'll fill out 2 hours worth of paperwork, even if I don't get it. And for others, I want to do a sure thing because it's very stressful for me. So I'll include the little list in there. It's 26 options. The reality is, if 2 or 3 of them work for an average person, that's actually a good match. But it may help you think differently about ways to find money. And just the last thing I want to say is I just want to support what Rachi said. There are people who are willing to help you, and you need to be very clear about what your boundaries are of asking other people for help, because many people will love to help you. You need to know in advance what your boundaries are for that.
Absolutely, absolutely. And
Amy, can I just add something else about
please.
What Idit said, and that is, I think often what happens is with fertility treatments in general, going through a process like this, is that we forget to take care of ourselves.
Mhm.
And because we're spending so much money on things that have to do with the immediate and the medical care and what we're really trying to achieve, then everything else sort of goes by the wayside, which is my emotional care, which is my physical care, which is, what can I do to make this journey easier? And I think it's very related to the financial issue, because I know you're going to be talking about how to take care of ourselves. But I
Yes.
think that we have to connect that piece of when it's talking about the financials, we have to also make sure that that's numbered into our numbers, that's put into our list of things that are really important.
Absolutely. Absolutely. And I love that you said that. And we're going to get into that actually in the next panel. But I want to actually circle back. First of all, Rabbi Soloman, Idit, can you please, you'll send me that list of your 26 resources, and we will include that also in the resource document that's going to be sent out tomorrow. So if you miss it here in the chat, don't worry, you will be getting it later on. But Rabbi Soloman, I want to go back to something that you were saying earlier about knowing when you're going to have a financial struggle or not. So you're 1000% right that people in the LGBTQ community, they know that fertility treatments are part and parcel of the way they're going to have a child. But other people don't necessarily know that. Some people decide to become parents, single parents by choice. Some people end up pursuing surrogacy or adoption, and that's not their first choice. It's because they weren't able to deal with, choice A, B, C, D, plan A, B, C, D, E, as Suzanne was saying earlier. Or people need to use donor eggs, donor sperm, donor embryos. So let's move away from the financial piece now. And now let's just talk about the emotional piece of realizing that this process is not going to be the way you thought. Your child is not going to happen in the way that you hoped and dreamed from the time that you were little. And so can you just talk a little bit, Rabbi Soloman, about what third-party reproduction is and what's it like to make that kind of a decision? And I recognize that I'm asking a question that is impossible to answer. I mean, we could spend 3 hours just talking on this, but we have about 10 minutes or so left in this segment. And I want to spend about half of it on this piece. So can you give us a little piece of this? And then I also want, Rachi, I know you deal so much with parents who are struggling in these realms as well. And I'd love to hear from you as well. So Rabbi Soloman first.
I think that the first thing that comes up in the area you mentioned is the stigma. Issues of infertility, I think because of so many of the amazing organizations that are part of this conference you're hosting are now here, there's a lot more awareness about it. A few of the remaining stigmas, though, are third-party reproduction, single parenting, and in particular, older women who are often in need of third-party reproduction. I suppose that the medical term is advanced maternal age, which is one of the rare times, although actually that's a little nicer than saying older women. So advanced maternal age may actually be the rare occasion when the medical is helpful. So I think it's getting past the stigma. I do believe in generations now in their 30s who are going to this, the stigma is reduced greatly. There are many more women who are comfortable approaching this. For many people in this situation, it just varies. For some people in this situation, there's just a loss. If you're in the LGBTQ community, it may have occurred to you that you are going to need a third party to build your family. And sometimes that's a given. For the heterosexual community, it's a loss and you need to go through the mourning. It's just the reality of it. And a lot of times when people are very focused on, I just want to have a baby, I just want to go through this, we don't go through the mourning. Grief waits. Like that could be the t-shirt slogan, grief waits. It does not go away. And if it's just mourning a biological connection to your child, if it's mourning you and your partner having an intimate moment and having that dual connection to your child, if it's mourning the fact that you may not carry this pregnancy, the mourning has to happen for you to be able to come to parenting from a place of wholeness. And that is almost always the case in third-party reproduction. Even for people who are very comfortable with it, usually it's because they've come to accept this. And if it is a moment, if it is a ritual, if it is a ceremony, if it is a therapist, if it's an honest talk with a friend, there is a loss. I mean, that's a reality because that's not how we go. So I think that that's one of the things that people don't talk about with third-party reproduction. We know the stigma, but the loss is, we just want to look over it because the reality is this is an opportunity to get to parenting. Yes, it's great, but especially, for example, in donor eggs, but it's true in donor sperm too. Like, no one grows up and says, wow, I wonder what my donor is going to be like. We imagine that our children are going to be like us. And often in the LGBTQ community, it's also the same thing. We still imagine, for example, our child's going to have our genetics. It just might be somebody else's. And that's just not always the case. And then the other is managing the logistics. Even if you healthily come through this and you're in a place, you've done your grieving and your mourning and you're a place of wholeness, oh my gosh, like, it's you look at a website of potential donors or of surrogates and whatnot, and for many people, there's an ick factor. It is very beautiful and amazing what people do to enable others to have a family, but you're reading through profiles of someone who might be the genetic connection to your own child, paying the fees, doing psychological analysis, going to a sperm bank and then researching them, talking to other people about it. We're not prepared. And dealing with the logistics. I mean, it literally takes, there's a process to it. It's not that you just go down to Walmart and I've now got my sperm or my egg and it's exactly like me and it's just what I wanted. So being prepared for that. And that's sometimes, I mean, like that's the case for everybody, is recognizing you're going to have to go through that. And then lastly is the finances. As we've said all along, third-party reproduction is expensive. And it's a kind of a reminder that this is probably not what you wanted to be doing. So those are some of the stages that I see people going through, not necessarily in that order. Dealing with the stigma, if it happens, dealing with the loss, which almost always happens, addressing the logistics of it and managing the finances of it.
Yeah, I mean, as I said, we could spend, 3 hours just talking about these pieces. And we actually have done, we've had many conversations on I Was Supposed to Have a Baby with people who work in all corners of third-party reproduction. Rabbi Segelman actually spoke to us about the halachos, the Jewish law surrounding it. We've had therapists come on and talk about the emotions. We've had people speak about their personal stories. We have lots of things on our website and on our podcast. I urge you all to take a look. But Rachi, I'm coming.
Maybe I'll just, if I could.
Yes.
Sorry,
and Rachi,
I wanted to add one more thing
exactly.
I want to add one more thing to, and sort of connect to a point that Idit, you made, which is, what the process having to do with mourning. But I think that the process is so important. Just going through a process of talking it through, because as Idit said, we didn't imagine that it was going to happen that way, or we didn't dream about that when we were growing up. I wonder what my donor is going to be. And the value of speaking to a therapist, talking about it with someone close, talking about it with whoever the person is that you feel safe that can hold it with you, is tremendous. It's often something that people aren't sharing. It's often a secret. The difference between a secret and a dirty secret becomes very confusing. And so we don't want it to be a dirty secret. We want it to be something that if the person chooses not to share, that it doesn't become something that is a deep, dirty secret that they can't talk about with anyone. And it's not something that they can sort of go over in their minds or out loud. And there's tremendous value to the process. The way I see something today and the way I see something after I talk it through, after I look at it from different angles, is going to be different. I'm going to be able to wrap my head around it differently. So even not only the process of mourning, but just the process of the whole thing, of the whole topic, of the whole way that I'm dealing with is so important. I think that's what all of us, encourage and facilitate and are doing. And I think the other point that I would add is also there's sort of a misconception that we're supposed to be 100% okay with things in life that we choose to do. I'm 100% on board. I feel 100% comfortable with this. And I think that something can be the right next step. And it could be something that I'm choosing to do and that I want to live with. And yet I have certain ambivalence about it. Today I feel 70% in favor and 30% against. Tomorrow I feel 20-80. There's so few things in life that look like 100%. I remember once one of my clients said to me, when she came in to do a process of donation, the nurse said, you need to be 100% sure that this is what you want to do. And what I said to her was, I don't really know what 100% looks like. It's okay if it isn't so clear to you all the time. And it's okay if you get startled and alarmed. And it's okay if it all of a sudden seems confusing. That is not an indication that it's not still the right thing for you.
And I'm gonna actually ask you one question further, because this idea of not being 100% in or feeling like things are not 100% settling, I think very much also has to relate to faith and spirituality and belief systems. And I want to spend our last few minutes talking a little bit about that piece. We know when things don't go as planned, right? It's not uncommon for faith, expectations, and belief systems to feel threatened. And we know that fertility challenges are one of them. There were many, many, many weeks, months where I couldn't open a sitter. I couldn't open a prayer book. I couldn't go to shul. I felt like synagogue. I felt like I was going through the motions in terms of my own religious practices and beliefs. And that has come back for me. But for many people, being in the midst of a struggle really calls into question everything they know about religion and spirituality, et cetera. So I guess my question is, can you give us some examples of what people go through when they're dealing with these challenges? I know that it's also common for people to get closer to God. It's also common for people to get further away. And just give us a couple of rituals, maybe if you can think of any that might help people. We have a couple of minutes, so I'm going to give each of you about 90 seconds to answer this, and then we're going to have to wrap up. Rachi, I'm coming to you first.
The main thing that I would say about our questioning our faith and things that are coming up as difficult as far as our relationship with God is I never saw anywhere that we're not allowed to cry from the depths and say, why is this happening to me, or why am I going through this? A lot of times I hear women say, oh, it must be that God left me because this isn't happening to me. And sometimes, and although I'm not a biblical scholar, sometimes I say, the whole beginning of our Bible is full of women who were supposed to want to be like, who went through, it's all one big fertility challenge. So that is, on the one hand, something that can encourage me to feel that, God hasn't left me, but on the other hand, doesn't negate my difficulty in accepting it, my crying out from the depths, my saying, why is this happening? Why do we have to go through this? And I think the importance of being able to accept ourselves in that and not, not feel guilty or not feel wrong or not feel like this is not okay, is so important, as are many, many things throughout the process of fertility, to learn how to accept my emotions and to learn how to be able to say, this is okay.
I love it. I love that. Idit, Rabbi Soloman.
First, Rachi is amazing, and I agree 100% with every single thing she said. I've developed a 5-point kind of spiritual checklist when I talk with people, because one of the things that we work with a diverse population, and many times people don't even look at this from a spiritual lens. And if they do, it's often like, sometimes it's why me, which is not a question that can be answered. Because usually it's reflecting something about a lack of control, just an utter sadness, and it's grief. It's a feeling of isolation. Sometimes it's a self-blame. What did I do to deserve this? And so I almost always find one of these, I'm going to put them in the chat, is one of these 5 areas. And Rachi actually touched on pretty much all of them. A lot of people need the ability, we have the lost art of lament, which I find is one of the most powerful things we can give to people. We used to biblically have criers. There were people who were brought in at a time of loss to help us cry. We have mourning, we have Shiva. And I think that people need to sometimes be given permission to have that sadness. They need to be able to give them the space and to have someone else present when that happens. The other thing I find about our spiritual life is it's not led in isolation. We want to connect, whether it's to God, to other people, to community, and sometimes it's just to ourselves. And going through infertility can break every one of those relationships. We can isolate from ourselves because maybe we're blaming ourselves or our bodies. We don't want to be around other people because this just socially feels isolating, if for many reasons, and also for God, if there's blame there. And looking at our relationships and reconnecting us is the first step that I found in that healing, which is really hard because people will say stupid things. And sometimes the relationship is to ourselves first. And as Rachi said, we need to have a lot of self-compassion. It's very hard to reach out to God. If that type of spiritual connection is meaningful to you, it's hard to reach out to God when we're disconnected from ourselves. So that relationship has to come first. And then there's just also recognizing where this may fit in the bigger picture of our meaning in life. And that we also do have an ability to choose how we respond to this. That's kind of the out of control nature that, it can feel like a really punishing God when it seems like everything we're going through is out of our control. And a lot of it stems from the fact that infertility was mostly out of our control to begin with, but we never knew that. And it's a rude awakening. And it's very disempowering. So regaining that sense of control, I think, can also bring us back into relationship with others, with the Jewish community, and to God. And there are many opportunities there. It takes a lot of self-awareness and patience. All of this, the healing can only come in those relationships with God, and our spiritual life can only come when we start with self-compassion for ourselves and just being open.
You are, you're almost serving up on a silver platter the end to this panel and the beginning of the next one. So thank you both.
Amy, can I add one more? Can I add one more? Just very small, short sentence, tiny.
Yes.
Okay, thank you. I just wanted to add, because also of the last question that you asked everyone, is if they had anything that they wanted to add, and I know I speak for Idit as well, is that anyone who's going through this needs to remember that they are worthwhile in the here and now. I understand they're on a journey, and I understand that they want to have a family. And it is of utmost importance that you remember that you are here for a reason, and you have what to give the world, and you have what to get from the world. And you're not only worthwhile when you're pregnant, and you're not only worthwhile when you become a mother. And it's something that's sometimes hard to hear and almost feels a little bit like a chutzpah for someone to say, but I think it's really important to say.
It is incredibly important to say, and I'm so glad that you said it. And I'm deeply grateful to the two of you. Both of your work is incredible, and your voice here has been so important. Thank you both so much.
Thank you.
We are now going to be moving to our third panel. But right before I do that, I must mention our silver sponsors. We have Extend Fertility, Fruitful, the organization that Chani Levertov runs in Arizona, Modern Jewish Couples, the National Bikor Cholim Conference that I partnered with actually in February when we ran the Perinatal Loss Conference, Ritual Well, Sviva, our incredible co-host and partner for the 2021 Fertility Summit, and the UJA. But right now we are turning to part 3, and I want to thank everybody for staying with us. We are going to be running about 10 minutes over, so please stay with us. But if you need to come out, absolutely know that everything is going to be recorded, so you don't have to worry about missing anything. But I am thrilled to introduce our third panel. We're now in all of the self-care pieces. That you are not defined by this is the title of our session. Self-care, boundaries, and how to advocate for yourself. Our panelists today are Karen Friedman, Dr. Karen Friedman, the founding director of Karen Geffen, Susie Holder, who has a master in science and clinical psychology. She is the clinical lead of Hain, an organization in the UK, and Rabbi Elan Segelman, the rabbinic director in America for PUA. Okay, so let's get started here. And we've been talking this afternoon all about different fertility challenges, be it infertility, be it people who have had losses, people who are dealing with third-party reproduction, people who are waiting for their fertility treatments, not yet waiting, thinking about it, not yet thinking about it. I mean, the kinds of struggles that people deal with in terms of, from the time they think they want to get pregnant to the time they're actually holding a child in their arms is frankly like innumerable. We could, spend all day talking about that. But people, what I'm most concerned about with all of you, and I want each of you to talk a little bit about, is this idea that when people are on this journey, they feel almost like defined by their pain. They feel defined by their struggle, by their grief. And often I can't sort of see beyond that. It's yes, they have their business people, they're community leaders, they take charge of plenty of other things in their life, but it's almost as if when they're failing at being able to build a family, it almost encompasses so many other pieces, and it's hard for them to look beyond that. So my question to each of you, and Susie, I'm going to come to you first. How do you respond to someone who feels like they're drowning in their pain, they're drowning in their struggle? And then also this idea that I want all of you to keep in mind is just how long does grief last? Like, how long does pain last? Susie, please.
Wow, that's hard, isn't it? Can we just sit with that for a minute? Drowning in our struggle. That's hard. That's difficult. And we need to acknowledge that as individuals. And that's one of the things that we need to do within a therapy situation. We all need to acknowledge how hard and how difficult it is. And we might be dealing with all sorts of things related to grief here. We might be thinking about loss of a child, loss of a baby, miscarriage. We might be talking about loss of hope. Yeah, loss of dreams, loss of role. What are we looking at here? What are we thinking about when we're dealing with all of that? And it can be very consuming, can't it? That feeling of grief, that feeling that we're drowning. Powerful words there, aren't there? And one of the big things that we do when we're fearful of something is we don't want to engage with it. We want to push it away and not think about it, not have anything to do with it. And there might be times that people actually do that, don't they? They take medication, they take drugs, they gamble, they do things to distract themselves from thinking about the difficulties that we're in. But you know what? Grief is really tricky. It's really unpredictable. And we can't really get away from it. It comes back. It comes back to bite us when we don't expect it to. We think we can manage it all. We think we can control it all, but it comes back. I think of it a little bit like as if I had a cupboard. If I had a cupboard and I want to put grief, difficulty in that cupboard, close it off, and I'm going to lock it up. I'm going to put all the locks on it, and it's banging on the door. I want to come out. I want to come out. But I'm going to put even more locks, another padlock, another, fix everything on it. I don't want to have anything to do with what's going on there. Oh no, but every now and then I'm going to have to open that cupboard and take my shoes out. I'm going to have to, it's going to come up for me, whether I like it or not. So that actually there's a really strong argument that actually managing it involves actually dealing with it and looking at it. And I know that sounds really difficult and really hard. But if we don't do it, it seems that the demons get even bigger and even more hard to control. And we need to find a way of doing that. And that might be connecting with people around us. It might be in a therapy situation that we feel safe, where we feel contained to say the things that we need to say, to do the things that we need to do, whether that be crying or shouting or whatever that might look like. And you know what? That's okay. It's absolutely okay to feel those things. They are normal, understandable emotions that you're experiencing. And remember, if you try to lock them away, they're going to come out. They're going to come back. But actually, if we take them out and have a look at them when we can, maybe there'll be times where we put it back in the cupboard. But if we look at it in a controlled way, we can learn to manage those feelings so that we don't feel like we're drowning in them so much, that we don't feel so engulfed by them, that we don't feel so traumatized by them. And that's the beauty of having a therapist or maybe somebody trusted that you can talk to about these things.
Beautiful, beautiful. Karen, I'd love to hear from you. I mean, Susie was speaking a lot about, you know, the normalization of these difficult feelings and giving some suggestions about what you can do for yourself, how you can self-care physically, emotionally. Can you add a little bit more onto that, please?
Yes. First of all, one thing that I want to say is, on one hand, we're dealing with women in Israel and Jerusalem mostly. And I listened about what happened on the panels before, where you talked about how much it costs for women to go through all the IVFs and all the treatments, and it's unbearable because of that. Well, in Israel, we have the blessing of having the financial support. So we've seen women actually here who have gone through 17 IVFs. So if you think of it in that sense of the amount of hormones, the amount of stress, the amount of excitement and failure, etc., it's something that we really feel here that it's not just enough to mourn the loss. What we have to do is pick up the women and say, okay, let's give you a toolbox which you can use in order to deal with your fertility challenges. And there are many things, there are many ways to deal with this, and there are many things that we have to build within your toolbox. And one would be the cognitive restructuring. One would be on, what do I think of my infertility? So when women come to me and say, oh my God, I've gone through 3 failed IVFs and miscarriages, I'm never going to have a baby. Well, we have to treat that woman with respect, but we also have to teach her how to challenge those cognitive misconceptions. The fact that you've struggled for a very long time does not mean that you will not succeed. There's many things that you go through in life, and there's many illnesses, and there's many things that you've gone through in schools, exams, etc. And afterwards, things have a way of working out. So we have to look at infertility as one of those challenges. And what are we going to do? And how are we going to continue with our life? and get through this. So one way is looking at things looking at things in a cognitive way differently. The other things is, what behaviors are you going to do when you go through this part of your life in order to improve your life? Because you are not just an infertile woman. That's just one part of you. But you are also a friend. You're also somebody with a profession. You're maybe a wife. You may have a partner. You have to imbue those relationships. And the other part is the real self-care, the yoga, the breathing, all of the things that you need to do to nurture yourself while you go through this very challenging period.
Perfect. Those pieces are so important, so important. Rabbi Segelman, I want to come to you and ask you about PUA's role specifically in self-care, and really what I mean actually is self-advocacy, because there is one piece of self-care, absolutely, is the yoga and the massages and the therapy and asking for help and learning about your boundaries, absolutely. And Susie and Karen spoke about those, and so many others that we could talk about. But there's another piece that people don't often talk about, and that's the self-advocacy piece. That's the, maybe when something is happening, that maybe you need to reach out and say, did the doctor really mean that? Or did the rabbi really mean that? Maybe there's room for a second opinion or a third opinion. So I'd love to hear from you when people are coming to you with their needs and their questions and in this state of just absolute horrificness and don't know where to turn. How does PUA advise and suggest that people get self-care and the self-advocacy piece of it?
Yeah. First of all, before I begin, I want to thank you, Amy, for putting together this incredible summit, and for everything that you do. Hashem should continue to give you the strength and the blessing to provide so many people with hope and support, and really just it's an incredible organization. So thank you so much for having us all on this afternoon, this morning's summit. I think that it's critical to speak about what the other panelists have discussed and acknowledging the grief and not shoving it under the rug, ignoring it, pretending it doesn't exist. And then there's a certain point where exactly what you said, advocacy kicks in. And I think that what that stems from is at a certain point, you realize that I'm not in control. And that lack of control can drive a person crazy because they're being pulled in so many different directions and there's nothing that I can do about it. And I just want to be in the driver's seat. I just want to be able to take control of my situation. Sometimes that's easier said than done. Sometimes you're in a situation which is objectively beyond your control. And sometimes what the doctors say, this is unexplained. I have no idea what's going on. And when you hear that from the doctor, that even my doctor, my physician, my specialist, someone who's supposed to have all of the answers, he tells me, well, you don't have a baby. I can't explain it. It's unexplained infertility. And you look, whether it's you look at your spouse, you look at yourself, you look at Hashem and you say, how could this be that no one's in control? At a certain point, I think it's important for individuals, for couples, to try to be as in control as possible. And sometimes what that looks like is establishing relationships with people that can help empower you make the best decisions, whether it's medical, whether it's halachic, as you mentioned, a therapist. And that way, when you develop those relationships, for instance, people call us all the time here at PUA, exactly what you said, not questioning the doctor, but just running it by us. One of the classic questions that we get is this: the doctor wants to go ahead with this protocol. Is that normal, right? Is it normal that I failed this? Is it normal that my periods are this? Is it normal that all of these things are happening to me? And the doctor said it's normal, but I just need to hear it from someone else, someone with a different perspective, whether it's a rabbi, whether it's a Jewish person, someone who's a religious person, whatever that individual looks like. And I believe that those types of conversations where we tell the caller, yes, that's normal, or if it's not normal, we will have to deal with it. But yes, that's normal. What the doctor said is definitely a viable approach. It's a good approach. Or if it's not, maybe we could suggest something else. And whether it's a halachic issue, the Rav said, I'm really not allowed to do this. Or Shabbos is coming and I have to schedule my treatment. I have to push off my treatment until after Pesach. We had a lot of those. With Pesach just behind us, Shavuos is coming. It's not as long as Yontif as Pesach. But when we have those conflicts between Shabbos, Yontif, and treatment, so sometimes people say, we spoke to my Rav, and my Rav said I have to cancel my cycle, push it off until after Pesach, and that's another 2 months down the drain, whatever it may be, based on how the cycle falls out. And you feel like you've lost control. You thought you were gearing up to a cycle. You were excited. You were optimistic. You had hope. And then your balloon was popped because we have to put everything on hold for 2 months. So even making the phone call to someone who is a resource in the medical field, is a resource in the halachic field, someone who speaks your language as another Jewish person, as another sounding board for your situation, even if we don't offer any other advice other than, yes, what the doctor told you is correct, go for it. Or yes, what the Rav told you is absolutely correct, go for it. Even hearing that gives the couple or the individual, whoever it may be, a sense of empowerment that I'm doing the right thing. I'm doing what I'm supposed to be doing. I'm in the driver's seat. I'm driving in the right direction. I hope I reach that destination, but I know that I'm following ways. I know that I'm going to get to that destination. Unfortunately, sometimes it takes longer than we expected, but it's so important to have that sense of empowerment, that sense of direction, that sense of self-advocacy, that I know that I'm doing the right thing. And hopefully that gives everyone the hope and the strength that they need to keep on going to eventually reach that beautiful, beautiful, fruitful destination.
Beautiful. That's exactly it. I think that so many people feel they feel just totally out of water. They don't know how to interpret. They don't know what the doctor is saying. They feel that they're almost afraid to ask. They're afraid to question. And so this advocacy piece is extremely important in this self-care space of really being able to make sure that you're feeling good about everything that you're doing in the process. I love what you said there. Okay, now as we close, let's do one more piece, the self-care and the connectivity. And what I mean by that is, Idit and Rachi in our last panel, they talked a little bit about the spiritual connections and the feeling like they have been, that we know that people have been sometimes brought close to God, sometimes pushed further away from religion, or just in general, feeling connected to other people, feeling connected to the process, feeling connected to friends and family who may be saying wonderful things and really supporting them, or feeling like they're saying just insensitive things and they don't know how to connect to the people around them. So I'm turning to each of you. Many people have written to us and they've said that they want to maintain those kinds of connections, the spiritual, the religious, their friends, their family. They want to maintain those relationships. And it's just really hard for them. So what might you respond if you were getting those messages? And I'm going to ask Susie and Karen to speak to that from the female point of view. And then I'm going to ask Rabbi Segelman to close us out from the male point of view, because we know, in many of these relationships, there are two people who are involved, and we know that men and women deal with challenges differently and emotionally have very different reactions to different stressors. So Karen, I'm going to come to you first. What would you say if someone came to you asking you this question? How can they maintain connectivity?
I think that first of all, I want to address partly the religious part, where I've had groups that have actually come from the Haredi, let's say the Haredi community. And one of the questions that would come up was, what do we do when we're put in a situation? I'm going to try and talk so that people understand that don't understand this jargon, where we have a male circumcision And they're asked time and time again, let's say, to be a krater, to have a role in this ceremony. And what they feel is that brings them so much shame and they brings them so much pain. And what they would say in a group is, if I'm asked one more time to do this, I just want the earth to swallow me. But I know that religious wise, I'm supposed to do this because it gives me a segula, which means like a positive thing from God, I guess. And I'm juxtaposing the two things. And how do I deal with that? So this is something where a therapist needs to know what exactly is the Jewish law, or what is custom, and how can you let somebody who's fertility challenged in that religious world, how can you let them navigate the situation and understand that there are other positive commandments that they can do that will raise them spiritually, and that they don't have to do everything that makes them feel depressed and uncomfortable, that taking care of their soul is also a Jewish commandment. That's sort of one way of the religious part that I think that we've dealt with. The other part is a lot of times people, like when you're saying giving yourself self-esteem and how do you answer other people, a lot of times people will come to women and they will also tell them, have you seen this doctor? Or the parents will say, what are you doing about things? And there's all kinds of uncomfortable social situations. And I think that what's important is to empower women to not to be rude and not to say things which will be harmful, but to have within themselves to come up with the answers that they feel good with, and that they can answer people, that they maintain their own self-respect, they maintain their own self-esteem. And sometimes I give people practice, go home and write out a list of things like, what can you say to your mother-in-law every time when you sit down, when she gives you another person, when she tells you to put the red thing around your wrist, what can you say to her, not to off her, but to maintain your self-respect and to keep going on with a positive situation.
I love that, because I also very much, I counsel people all the time. I say, you need to prepare your answers in advance. You don't want to be caught off guard. You need to prepare them in advance so that when these insensitive comments come, you can just reach in. It's not that you're getting flustered and then you don't know what to say.
There's also one other point that I want to make, and I think this is maybe saying something with what Rabbi Segelman was saying before. I think it's so important that when women and couples reach out to religious authorities, that they have to understand that there are rabbis that specialize in this, and not every rabbi of every community can tell them what to do. I mean, I think, I don't know how to say this also, but you have to be machmir for fertility, meaning that you have to be very strong knowledge in Jewish law in order for the fertility to be able to come forth. And I think that Pua does an excellent job of that. And also Nishmat or Yoatzot Halacha, that sometimes women need to go to another woman to hear their halachic response. That's also very important, to empower yourself to know which people you need to reach out to in order to succeed on this journey. So I hope I answered your questions.
Absolutely. Absolutely. Thank you so much for that. Susie.
Thank you so much. Because Karen has beautifully picked up on some of the religious aspects that I was going to pick up on as well. I think it would be good to turn a bit to the emotional side as well, more so, and thinking about the fact that it's really important as part of that self-care process, as Karen has said, to validate your emotions and understand that everything you're experiencing is normal and really understandable given the situation that you're going through. Because I think that you need to do that. You need to accept that it's normal and understanding to be able to actually create the self-care that you need. And that whatever that might look like, that might be reaching out to an organization like PUA, looking for self-advocacy, looking for a therapist that's going to help support you, looking for somebody that's going to help you navigate through the difficulties, looking for the financial support that you need. Whatever it might be that your needs are, you actually need to begin by actually acknowledging them. And I think that that's sometimes really tricky for people to do. And it actually takes a discussion with someone else, whether that be your husband, wife, partner, whether it be a trusted friend or perhaps a therapist, to actually work out, what do I need? What is it that I actually need in this situation? What is the actual difficulty that I'm dealing with? And recognizing your own need for self-care. You've mentioned boundaries already. That's really central to your own self-care. It's like having an internal safety net, as it were. What can I do? What can't I do? You know, making sure that you don't overextend yourself. You don't have to accept every invitation that you receive. We're such people pleasers. I do it myself, I know. We're such people pleasers. We say yes to stuff and then we think about it. We think, actually, I really don't want to do that. Why didn't I say no? It's okay to say, can I have a think about that? I'll come back to you. If you can't decide in that moment what you need to do. And actually, we need to learn to say no. That's okay. There are times when we need to say, no, I can't do this. I need to acknowledge that in this situation, it's going to be difficult for me. I might need, as you say, Amy, an off-pat answer. It might be, thanks so much for asking me to do this, but actually I've been quite unwell recently or tired or whatever you want to say. And you know what? I'd really like to catch up with you another time. Would you mind terribly if we just don't do it on this occasion? Also, you're entitled to your privacy. You're entitled not to respond to insensitive questions, unsolicited advice that you're going to get. It's okay, again, to have an answer. Thanks for checking in on me, but I hope you don't mind. I really don't want to talk about this at the moment. I hope that's okay. It might sound harsh, but you know what? It's harsher to deal with what they've given you.
Definitely.
So, and the other thing that I would say as well is the role of social media here as well. Be really careful what you do. You know, you can get quite obsessed with things on social media. Excuse me. Be careful to dip in and out, to recognize what your needs are as well there. And finally, remember, when you're thinking about your role in your life, there are other ways perhaps that you might need to think about considering your role as maybe, you know, am I going to be a mother? Am I going to be a father? Are there other ways that I can fulfill that role in my community in a different way? Would I need, you know, are there ways of volunteering, mentoring, maybe adopting, surrogacy, whatever it might look like? Are there other roles that I can fulfill that will go some way, even if it's not fully, to fulfill some of the needs that I have as a person?
I love that. I love that. Thank you so much for sharing all of that. It's so many of those pieces, all of those pieces are so important for people in terms of their own self-care and getting through these times. Rabbi Segelman, I'm going to ask you to help close us out for this morning, this afternoon, depending on where you're tuning in the world. Give us a little bit on the male perspective of connectivity and self-care and how we can make sure to support the people in our lives that are not the women.
Yeah. First of all, thank you, Susie. Very, very well said. And Karen as well. I actually want to pick up on something that Karen said, which really spoke to me in my space as a rabbi, both as a communal rabbi and also my role at PUA, knowing the difference between what is halacha, what is actual Jewish law, and what is a practice, a minhag, a chumrah, something, a stringency, which has over the years or societally been accepted as baseline halacha. Because often people feel that they are not doing what they're supposed to be doing. They're not obeying the law. They're not abiding by the Torah's expectations. And if they would just organize and clear up kind of this really murky water, what am I obligated to do? And what is, the cherry on top? Because the cherry on top might not be right for me. And if once it becomes one mix and I don't know my right from my left, what's obligatory and what's not, people often feel down about themselves and shameful and guilty when really it was totally, totally unnecessary. And making things clear and and just setting a person on the right path, knowing that what you're doing is signed off by the rabbi, that also makes them so much happier, so much more calm and able to connect to religion and to Judaism, knowing that no, they are doing the right thing. I did run this by a rabbi who knows what he's talking about and who told me that this is okay. So that is just one piece that I really, really think is extremely important and a really important tip to help people connect to Judaism and to stay connected while they're going through this turmoil. I think another important point when we speak about the male is education, because statistically, whether we believe it or not, male factor infertility is just as common as female factor infertility. And as much as we stress the female side of things, it could often push the male into the corner and isolate him even more. But really, when the male learns about how common it is and how normal it is, and how he is not just one in a million, but he is part of a community of other people that are struggling with the same struggles, with the same diagnosis, with the same medical situation, whatever it may be, genetic or non-genetic. There is so much education out there that we have to bring to the community to inform the male population that male infertility is just as common as female infertility. And it's a fascinating discussion how that may even impact halacha, Jewish law, our attitude towards testing the male versus testing the female, totally beyond the scope of today's discussion. But I think bringing the male into the picture and validating their feelings, validating the male perspective, and often, the husband has to learn how to relate to and to support his wife. And all of a sudden, recently, we're kind of shifting gears and speaking to the female. How is she going to support her husband when he feels that he lost his male identity? He lost his manliness. And here he is, the one who has to go through this procedure, and the wife, and now he feels extra horrible because his wife has to go through, unless he's having a surgery, but his wife is the one who's going to go through the hormone injections, and his wife is going to go through the retrieval, and his wife is going to go through this, when really it's all his quote unquote, it's his issue. So I think that allowing the male voice to be heard, the male voice to be part of the conversation. Some males don't need it. Some males, on the contrary, they don't want the focus. Don't talk to me about this. I'm fine. I'll deal with it in a quiet way. My wife is the one who needs the support. Sometimes you'll find those males, and others you'll be very interested to see that the more there's a discussion, the more the male will realize, and he may not have even understood this from the get-go, but he'll realize, wow, that support, that conversation, that helping hand was so important to me, and I didn't even know that I had that bone in me. I didn't even know that was a part of my DNA, the need to talk about this, the need to connect with someone, to connect to another man who's going through the same thing. So I guess the only thing that I could, or one point that I would like to bring to the table is really to applaud the men here in this summit for tuning in and for connecting with other men. And I can tell you, as a male, someone who speaks to male all the time, I can tell you that there is a whole male community, and how much support and how much chizuk and how much inspiration that has given to the male community who are suffering themselves and as an individual and as part of the marriage, knowing that their wife has to go through X, Y, and Z. So I guess my parting words to echo everyone that has been speaking on today's summit and has so eloquently offered words of inspiration and encouragement and hope is that as the panelists, as these organizations, we are dedicated to you. We are dedicated to the Jewish community in whatever area of support you need, financial, emotional, medical guidance, halachic guidance, direction in Jewish law. What Amy has done is brought everyone together to showcase and to inform and to educate and enlighten the Jewish community of all of the resources that we have available. And whoever you are, whatever your situation is, whatever gender you are, feel free to reach out, because the resources are there and we can help you overcome this struggle and this challenge together. So thank you, Amy, for having us. I think it's an amazing, amazing opportunity.
I could not have said that better myself. We are all here for you, and this is exactly what this summit is all about. Rabbi Segelman, Susie Holder, and Dr. Karen Friedman, thank you so much for closing us out for our morning/afternoon session.
Really, thank you.
Thank you so much.
Thank you.
And before we leave, I want to acknowledge what we've been able to accomplish in this short 90 minutes time frame. If you look into the chat right now, take a look. We want to ask all of you in 1 or 2 words, what has this gathering meant to you? What has it made you feel? We're going to be posting it up on the screen, and then we're going to be posting that on our social media a little bit later today. Really, as you're doing this could not have been done without all of our incredible sponsors. And I want to specifically mention the friends of our summit. And I see a number of you putting it into the chat. Go into the Menti, click that link and put your words directly into the Menti. You'll see it's starting to populate there now. And I just want to, again, thank all of our sponsors. And now I want to share the summit's friends, Bamidbar, BASE, CCAR, Honeymoon Israel, JQY, JScreen, One Table, Our Love Continues, RMA, Seeds of Hope, Tribe 12, Union for Reform Judaism, and Women of Reform Judaism. Thank you all. And thank you to the phenomenal speakers, all of the speakers today, for bringing your expertise into this field, where these types of support were still relatively uncommon until recently. We could not have done this without you. We look forward to continuing the conversation. 8 p.m. tonight, Eastern Time. There is a separate link. You all got 2 links in your email, so check the separate link where we will explore the ways that community, family, and friends can best support those who are struggling with their family building process and who have found themselves on the other side of fertility, the end of fertility, those people who are childless not by choice. And please remember, if you are unable to attend, this is a reminder that the entire program's recordings, both today, right now, and this evening, will be available after the events conclude. And to all of you, if we at I Was Supposed to Have a Baby, if we can support you in any way, please reach out. At I Was Supposed to Have a Baby, our mission is to utilize all social platforms to be able to support anyone in the Jewish community who's struggling to have a child. We provide a warm and nurturing space for anyone going through infertility, pregnancy loss, infant loss, surrogacy, adoption, etc., in addition to connecting them to resources in the Jewish community at large. That's what we've done here today. And we have an entire community of men and women who are all yearning for parenthood. No one should ever have to suffer alone. Bye-bye, everybody, and we will see you this evening.